Give me a moment. Huh. Okay, thank you. I feel much better. My name is Dr. Alireza Panahpour. I was born in Tehran, Iran. I've always had an amazing curiosity for creation, for art, been a very curious individual throughout my life. But if I had to really sum it up, I would say I'm a happy warrior. I try to fight for the good cause, speak for the people who can't speak for themselves, and fight for the ones who can't fight for themselves. My passion in dentistry started very early. My father was a dentist. He is a dentist. My brother is a dentist. So it's in my blood. My father used to take me to his office as a child, and all I loved to do was watch him work. I even assisted him as a child with his big surgeries and work in the dental laboratory. That was my passion. That's what I wanted to do all day. You know, I'm a professional student. I have spent ample time on every subspecialty, every residency program, anywhere from chirodontics to TMJ problems, to facial rejuvenation, to aesthetics, to full mouth reconstruction, you name it. Before I became a dentist, I had to take physiology, histology, biology, chemistry, genetics. I mean, I can go on. And one thing that all these classes had in common was the periodic table. So number one most toxic substance in the world on our periodic table is plutonium. And what do we do with plutonium? We make atomic bombs with. Number two most toxic substance element in the world is mercury. So how could any amount of mercury be safe? So I started asking questions really early in my dental career. Again, I was frowned upon. I was told that I just need to hush up and just continue the program. Well, that did not settle with me. Thank God for my travels. I have family all over the world, so summers, vacations, I was always abroad. And I have a lot of family that are also in the medical field. I remember in 1993, I was in Sweden and I was going through a training to become an implantologist, so I can start doing implants in my practice. And it was then that Sweden banned mercury. I was so excited, I was so just butterflies. I come back to the States, I had ample amount of research, not only from the university in Sweden, but the World Health Organization, that look at what the research has proven about mercury in silver fillings. But unfortunately, due to certain governmental agencies and their interest, I was frowned upon. I was even being attacked by speaking out the truth. Most of the people that go to the dentist have no idea what's being placed in their mouth. There's actually gag laws placed in some of the big states that a dentist is not allowed to tell their patients there's mercury in their silver fillings. Any manifestation, any alteration on the oral cavity, on this cranium that's supported by your upper and lower teeth, will definitely have a manifestation on the rest of your body. Tooth decay, gum disease, dental infections, TMJ issues, cranial issues, these are all chronic inflammation. High blood pressure, diabetes, GI issues, cancer, these are all manifestations of chronic inflammation. And we know that chronic inflammation is responsible for more than 80% of the healing crises that we're dealing with as a public. Your teeth are true barometers of your health, honestly. Every teeth has a arterial, neural, lymphatic connection to the rest of the body. So if something is off, if something is diseased, if something's not right with this oral cavity, with the harmony of your cranium, and that will have a ripple effect on the rest of the body, and vice versa. And what we have seen within the past 2 years, what they refer to as oral medicine. For example, early 1990s, if you were diabetic, you had gum disease. They went hand in hand. Now, 20 years later, we're not sure if the diabetes causing the gum disease or the gum disease causing the diabetes. So tooth decay, TMJ issues, clenching, grinding, they're all a systemic manifestation. More and more research now is being presented to us as showing us the link of dental infections to the rest of the body. So if you have an infection in your mouth, well, your liver, your kidney, your adrenals, your GI, your whole system is going to be reacting to that disease. So the whole concept of teeth are not a part of the body, that's passe. That does not stand no more. I'm not your average dentist. I'm not the drill it, fill it, bill it type dentist. As I said, if you come to me and you've had broken fillings every few months, or any other issue, I need to get to the bottom of it. Is it systemic? Is it mechanical? Or just incompetent dentist?